Good afternoon. I know it's an exciting day. Good afternoon. From day one of the legislative session, and frankly, long before that, Democrats have stepped up and said that our job during this session is to make sure that the people and the economy of Montana have the opportunity to be healthy and prosperous into the future. Our mission from day one has been to identify issues facing our people and to lead with solutions for the people of Montana. Today, we take a very large step in accomplishing that goal. I'd like to introduce a champion, an advocate for those folks in Montana, someone who has tirelessly fought for the folks of Montana's right to being healthy, Representative Mary Caferro.
Thank you everybody for being here today. I said earlier, I feel like I finally made it to the grown-ups table. I am so proud to be sponsoring this bill to extend Medicaid expansion. In 2015, I co-sponsored the HELP Act, Montana's Medicaid expansion. I thought it made sense to include a sunset, so I supported that. We wanted to be sure that the program was a good deal for Montana families and Montana's economy. Now, 3+ years later, the jury has returned with a verdict, and Montana's Medicaid expansion is firing on all cylinders. Thank you. Here's what we know to be true. The population of Montana is healthier. It has provided a backbone to our businesses, especially small businesses. It's generated hundreds of millions of dollars for Montana's economy all across the state in every county. And it has thrown a lifeline to our rural hospitals and empowered Montanans to seek preventive care when it makes the most sense. That's why today I requested a bill for clean reauthorization of Montana's Medicaid expansion. Our bill will be called the Keep Montana Healthy Act. Just like in 2015, the people of Montana, we're seeking input from the people of Montana. We want a totally transparent process, one that is informed by the public, informed by people who have Medicaid, informed by stakeholders. We want this to make sense, be relevant for people in Montana. So we're inviting all folks to be involved in the process. This is just the beginning. We as Democrats are committed to preserving the health of our constituents. We're committed to working shoulder to shoulder with Montanans to come up with a Made in Montana solution, just as the 2015 bill was. Keep Montana Healthy will be a unique approach that takes into account the rural and vast nature of Montana and our healthcare delivery system, as well as supports the independent and hardworking folks who roll up their sleeves and show up every day. It will support the 18,000 businesses in Montana who employ someone enrolled in Medicaid, and it throws a lifeline to our rural hospitals. That's why, like I said, I'm proud to support the Keep Montana Healthy Act, and I'm proud to stand here with all of you today to support our folks. Now I'd like to share a story, because as you know, Montanans on Medicaid are working, whether they're employed, going to college, or being a caregiver. And we all know caregiving's work, right? Yeah. This story comes from a mother, Andrea Mille from Havre. When my ex-husband left our family, I became the primary and only caregiver for my 2 children who have autism, who are now 19 and 21. My job of caring for my children is 24/7. I'm never off the clock, and for our family, there's no downtime. That means if I get sick, my kids' care suffers. It is the utmost importance to us that I stay healthy and keep on top of my health care. This is mom talking. But after the primary earner in my household left, our income went down to $170 a month. This leaves leaves absolutely no wiggle room in our budget for sky-high health insurance premiums. Health insurance would have been completely out of reach. Luckily, I had another option to keep me and my kids healthy. I qualified for Medicaid expansion. Medicaid expansion gave us the resources to access preventive health care and make sure I stay healthy for myself and my family. Being a Medicaid enrollee means I get wellness and checkups, mammograms, eye exams, and the preventive care I need. My family has a history of illness like diabetes and cancer, and preventive care is critical to me so that I can continue to care for my children. But if I don't have access to Medicaid, I never can afford to go to the doctor. I'll be taking care of my kids for the rest of my life. It's a full-time job, and it would cost north of $40,000 a year to hire someone to care for my children. So she's saving the state money, in case you didn't get that. For these reasons, work requirements would be an impossible bureaucratic standard for me and my children. Even mandatory volunteer hours would mean taking time away from caring for my kids and helping them connect with their community. Additionally, I would then be forced to pay someone to care for my kids. That makes no sense. Out-of-touch politicians don't know what it's like to be in my shoes, and for my family, Medicaid expansion has been a lifeline. Thank you from Anne Gray Milling. To introduce our first speaker, Colleen Campbell.
Hello everyone, thank you for being here today. My name is Colleen Campbell, and I currently have an internship with Western Native Voice. I am a Fort Peck tribal enrolled member living here in God's country. I would like to share my story as a working class woman on Medicaid who has chosen a simple life for certain reasons. My mother, Jewel Perry, is a 62-year-old member of Fort Belknap Indigenous Country. She has been a foster parent for 25 years. She has had up to 6 children at a time who are transitioning in and out of her home from infant stage to adulthood. Over her lifetime, my mother has had over 50 foster care children in her home from various tribes. Most of them have been on Medicaid. These children have relied on Medicaid to receive mental, physical, and emotional care they've needed to address their growth. Medicaid has also helped with the travel to and from various cities in Montana, which is necessary to address the various medical needs of the children. In 2015, Medicaid threw a lifeline to my family once again. My mother started having heart problems and was scheduled to have surgery in Billings. When we arrived, they decided to life flight her to Salt Lake City for a complicated procedure that only the medical team in Utah could address. My family spent over a month in Salt Lake City as my mother survived and healed. This could never have been possible without Medicaid. We are grateful for the great state of Montana and Medicaid expansion that helped my mother during her most difficult times. To this day, she continues to be an adoptive parent, foster parent, and single working homemaker on Medicaid. I choose to stand up here today and let my voice be heard for those who cannot be here, for those who need help with Medicaid expansion, and to achieve mental, physical, and emotional healing throughout the great state of Montana. We are asking Montana lawmakers to stand up and protect our families as we all heal and grow. I am the working class woman on Medicaid that has chosen a simple life. Thank you.
Thank you, Colleen. The next speaker is Dr. Turner from Peerview here in Helena.
Thank you. Hi. My name is Dr. Madeline Turner, and I'm a primary care physician here in Helena at Peerview Health Center, which is a community health center. We provide nearly 30,000 patient visits each year to over 7,000 people. We provide them with a medical home where they can receive comprehensive primary care, dental care, behavioral health care, and access to low-cost prescriptions. Over 38% of those patients, or around 2,500 of them, have Medicaid.
I am here today to stand up for those 2,500 Medicaid patients and all Montanans with Medicaid. Without insurance, these patients would go without access to basic medical care, including urgent care visits, preventative health, and mental health care. Patients would also be less able to get treatment for their chronic illnesses, such as diabetes and hypertension. It is much more difficult and expensive to take care of untreated chronic illnesses and the associated complications that come with late-term care. I'd also like to tell a patient story, and I can think of so many examples, but one patient always sticks out in my mind as she truly reminds me of myself in several ways. She was born and raised here in Montana. She's a single mother of two school-age children and is their sole wage earner. She works as a waitress. Even though she is working, she can't afford private health insurance, and health insurance was not offered by her employers. However, and thankfully, she did meet Medicaid expansion criteria, so was able to get health insurance through Medicaid and was excited to finally come see me for her preventative care visit, which she hadn't been to a doctor in years since the birth of her last child. During this visit, we performed all the routine health screening that was recommended, including cervical cancer screening. Unfortunately, she was diagnosed with early stage cervical cancer, but thankfully with Medicaid, I was able to refer her to a specialist where she was treated and cured. I believe strongly that because of her access to insurance and hence adequate medical care, she was diagnosed early, which gave her a better prognosis and a longer, more fulfilling life with her family. This is not an uncommon story. Medicaid patients are everywhere. They are our waitresses, our parents, our grandparents, our service workers, and our farmers and ranchers. Just one final plea, please support the renewal of coverage for over 95,000 enrollees. The patients we serve are our Montanans. They are friends, families, and our neighbors, and they deserve access to health care. We cannot go back. If Medicaid expansion is not renewed, I will not be able to fully perform my duties as a primary care physician to help these patients be healthy. Thank you.
Thank you, Dr. Turner, and we have one last speaker, a small business owner, Chelsea Rice.
Thank you so much, Mary. I am here today to advocate on behalf of my employees. My name is Chelsea Rice, and I am a small business owner in Montana, Helena, Montana specifically. I am also a cancer survivor. In 2012, I was diagnosed with cancer and denied coverage for a pre-existing condition. I know firsthand what it feels like to not have medical coverage. As a new business owner, I have few employees at few hours in order to sustain my business and our presence in my community. Also, to preserve my bottom line throughout the year. My employees are young, they are developing their careers, and they're learning how to sustain themselves economically. I am, as a new business owner, trying to do the same. In order for them to do that and for my small business to thrive, my employees must have health coverage. They must be able to access preventative care. Medicaid, and more specifically, Medicaid expansion provides the preventative coverages that is needed by all three of my employees. Coverage that will prevent lost hours and lost wages. In fact, every one of my employees is on Medicaid or Medicaid expansion. We all want our small businesses to thrive, our mom and pop shops to remain in our small business communities. They are economic drivers for all of us, and I don't just want to be successful in my own business, I want my employees to be successful and healthy as well. I have assessed the cost of private health care for my employees and cannot shoulder the burden outside of providing them with catastrophic coverage. If employers had privately covered all Montana workers through Medicaid in 2017, the cost would have been approximately $353 million to $941 million. weeks. Being a small business would be out of reach for me. I'm honored to be a part of our small business community here in Helena, especially as a cancer survivor. I am lucky to be alive. I protect myself through private coverage. Let's also protect our retail and service workers. Thank you.
Thank you, everybody, for being here, and I'd be happy to take questions. This is not exactly a straight extension. This is a starting point. I have a bill that we're going to move along. For sure, we'll remove the sunset, and we're opening up to the public to hear what they think we need to do to improve it if we do need to make improvements. That's really important to notice, is that we're having a transparent process on the Democrat side. So there could be changes.
Is there a timeline for introduction?
There is not a timeline, but the reason we started so early is because we need to ensure that Medicaid expansion continues and we protect our constituents. Because without it, they lose their health coverage on July 1st.
Will you be working with Senator Buttry on his proposal?
I don't know what Senator Buttry's proposal is. I haven't seen it, and so I can't comment on it. I guess it would depend on the content, but as you know, it hasn't seen the light of day.